This is part 4 of the lecture notes for chapter 1, and we're actually starting with slide 7. A lot of times when you're learning these parts, and you should know these, like by heart, but a lot of times you don't know how to say some of them, you don't know how to pronounce them. So I'm just going to spend some time on the anterior view or ventral view of this anatomical man here. And notice he is in the anatomical position. He is standing upright, facing forward. His feet are slightly spread apart and his palms are facing forward and thumbs are extended to the sides or laterally. So I'm going to say these terms and also the common name that we usually use for them. So cephalic is just the head region. All right, frontal is the forehead. Orbital is the eye, and sometimes that's also called the ocular, but we'll use orbital. And nasal is the nose, buccal is the cheek, oral is the mouth, mental is the chin. And a lot of times you're going to find structures in the body whenever we go to memorize, like the bones and the muscles, they're going to use these names. I'll just use the forehead, for example. The bone of the skull that's in the forehead region is called the frontal bone. The muscle that stretches out over the forehead muscle, I guess you could call it, is called the frontalis. So that's just one example. Cervical, it means the neck region. Thoracic, it refers to the chest region. And the breastbone area is sternal. The armpit area is axillary, and the breast area is mammary. The abdominal region in purple, that's shown in purple here, the navel is the umbilical region, and then we have the pelvic region, which is below the abdominal region. A lot of times the abdominopelvic cavity is one body cavity. But the groin area is called the inguinal region, and then the pubic area is the genital region. And this is the same in males and females. Pubic area is just the genital region. Then we have the upper limb or the arm, and the shoulder region is the acromial. The arm, the word arm in anatomy is talking about the upper arm. So make sure you know that when we say arm, we mean the upper arm, and that's brachial. We talked about this example earlier when I was telling you about having blood drawn. The bend of the elbow is called the antecubital region. The back of the elbow is the olecranal region. That's written here, so I wanted to tell you that's referring to the back of the elbow. The forearm or lower arm is the antebrachial region, and the wrist is the carpal region. The entire hand is the manus or manual region. The hand part, the hand part that doesn't include the fingers is called the metacarpal region. The palm of the hand is the palmar, and the thumb is called the pollex, and then the rest of the fingers are digital, or digits, or digital. Then we have the lower limb. The hip region is coxal, the thigh region is femoral, the kneecap is patellar, and the back of the knee is popliteal. The in anatomy, the leg is actually the lower leg. If we talk about the upper leg, we're saying the thigh, okay? So the lower leg, the leg is the crural region. The back of the leg or the calf is the sural region. And then we have the lateral side of the leg, which is the fibular or peroneal region. Then we have the foot, which is called pedal. The ankle is tarsal. The heel is calcaneal. The top of the foot is the metatarsal. And all of the toes are digital, except for the big toe or great toe, which is the hallux. And then the plantar region is underneath the digits. It's the part of your foot that you stand on. Okay, so come on. Next slide. So now we have the anatomical man that's turned around facing, we're looking at his posterior region, and we have some of the same terms. We'll start with the upper limb on this side. We have the shoulder acromial, the arm brachial, and remember arm is upper arm. The antecubital is on the anterior side. We can't see it, but it's the bend of the elbow, and now you can see the elbow, and it's the olecranal region. The forearm is the antebrachial, and the wrist is carpal. You can see the metacarpal region is actually the back of the hand, and then the digits are the fingers. The lower limb, you can see the thigh region. You can't see the hip region shown here, the coxal, but you can see the femoral or thigh region. You can see the popliteal or back of the knee. You can see the psoral region or calf region. You can see the fibular, which is the lateral portion of the leg. Remember, leg is lower leg. You can see the calcaneal, which is the heel, and you can see the plantar portion of the foot. Okay. Then we have the otic region, which is the ear, the occipital region, which is the back of the head. The cervical again is the neck, the scapular, shoulder blade, vertebral is the spine, lumbar is lower back, sacral is just right here where your sacrum is, which is the lower part of your vertebrae. Gluteal or buttocks region, perineal, which is between the anus and the external genitalia. Okay. And then we have, moving on, we're going to look at the body planes or sections. If the body were to be cut into a section, we have sagittal, frontal or coronal, and transverse or horizontal. And then the sagittal, they don't have a picture. Let's look at these in pictures. Okay, so this is a mid-sagittal plane. Sagittal means that it divides the body into left and right halves. If we're looking at her, this is her left side, and the right side is kind of faded looking. So it's dividing her body into left and right sides. If it's a mid-sagittal, it's equal left and right sides. But you can have a sagittal plane that's not mid-sagittal. Okay, then we have frontal or coronal, which is going to divide the body into front and back, or anterior and posterior portions. And a transverse or horizontal plane is going to divide the body into a superior portion and an inferior portion. And this shows you the MRI scans that are done when the body is divided into these sections. Okay. All right, body cavity, section 1.6. We have two sets of main body cavities, the dorsal body cavity, dorsal, remember, is posterior or back, and the ventral body cavity. And the dorsal body cavity contains the cranial cavity and the vertebral cavity. So the skull and the vertebrae are found in these cavities. So this shows you or protect these cavities. I'm sorry, they protect these cavities. The skull is outside the cranial cavity, and the vertebrae are outside of the vertebral cavity. But this is the dorsal body cavity, and you can see everything in yellow. Cranial cavity here containing the brain, and vertebral cavity containing the spinal cord. And over here, what you see in red is the ventral body cavity, and that's going to include the thoracic cavity, which is above the diaphragm, and then the abdominopelvic cavity, which is below the diaphragm. Let's go to thoracic cavity first. The thoracic cavity is divided into the pleural cavities, which are going to be the right lung and the left lung. So there's the right and the left pleural cavities. And then there's the mediastinum, which is there's a superior portion, and then there's an inferior portion, and the inferior portion contains the pericardial cavity, or which contains the heart. So it's between the lungs, and then you have the abdominal cavity and the pelvic cavity within the abdominopelvic cavities. So the thoracic cavity, again, contains the two pleural cavities, one for each lung. The mediastinum contains the pericardial cavity, which houses the heart, and other organs that are within the mediastinum are the esophagus and the trachea. The pericardial cavity encloses the heart. Abdominal cavity contains the abdominal organs like the stomach, the intestines, the spleen, and the liver. And the pelvic cavity contains the bladder, the urinary bladder, reproductive organs, and rectum. Okay, so this is a clinical example. Problems occur when structures stray into neighboring cavities. An example of this is a hiatal hernia, which is when part of the stomach protrudes through the diaphragm into the thoracic cavity. And it may require surgery. Okay, we need to know the membranes in each ventral body cavity. The membranes are called serosa or serous membranes. So serous membranes, we're going to learn other membranes like mucous membranes and that kind of thing, but these are serous membranes, and there are three. There is the pleural membranes, or the pleura, the pericardial membranes, and the peritoneum, the pericardium and the peritoneum. And each of these serous membranes have a parietal layer and a visceral layer. The parietal layer is on the outside, the visceral layer covers the organs, and in between those layers is a cavity filled with serous fluid. So the three membranes are the pericardium, which houses the heart, the pleura, which houses the lungs, and the peritoneum, which house the abdominal organs in the abdominopelvic cavity. Each of these membranes works kind of like this. If you can picture punching your fist into a balloon, the part that touches your fist would be the visceral part. And then the part of the balloon that's outside, that has a layer of air between it and the visceral part, that's going to be the parietal part of the membrane. So all these serous membranes work that way. There is a parietal pericardium that touches the heart. I said that wrong. I'm so sorry. I don't want to re-record. So the part that touches the heart is the visceral pericardium. Then outside of that is the parietal pericardium, and in between the two layers is called pericardial fluid. Serous membranes can become inflamed, and this can cause pain. Some examples are pleurisy and peritonitis. All right, and then we're going to talk about quadrants and regions, abdominal quadrants and regions. So with abdominal, and what these are used for is to help to explain where a structure is located or pain is located, that kind of thing. There's the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. They have abbreviations, as you can see, and let's look at some pictures. All right, so for example, in the right upper quadrant, we can see that the gallbladder is located there. In the left upper quadrant, we're looking at the major portion of the stomach. The right lower quadrant, we can see the appendix. The left lower quadrant, we can see the rectum. So the lower part of the sigmoid colon is what it's called in the rectum. And in both right and left lower quadrants, we can see the urinary bladder. Okay. Now, in the regions, which are a little bit more difficult, let's see. The regions are up here. If we start in the middle region is the easiest because these are divided into 9 regions. The middle region is the umbilical region. Above that is epigastric. Below that is hypogastric. Then if we go to the left or the right side, we have right hypochondriac, right lateral region or lumbar, right inguinal or iliac region, and then on the left side you have the same terms.